Hello, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you a community COVID briefing as of September 27, 2021. It's been a few weeks since we've talked, and so I thought I'd just provide an update, kind of what's going on, certainly across the state statistically, and then what we're experiencing here locally as well. So again, some of the trends may be a little more important than others, but I'll let you be the judge of that. And so we'll just get started. The Iowa 14-day positivity rate today is 9.4%. Previously, a week ago, that number was 9.1, so it has gone up a little bit. The other number that I have is from September 9, and so the rate was 8.9 then. So on September 9, 8.9 till today, 9.4. The 7-day positive rate is 9.6. Last week, 9.1, and on September 9, 9.0. So kind of a steady increase there as well. Sioux County is a little bit different, a little bit less. Continues to be about roughly half of that rate. The 14-day positivity rate in Sioux County as of today is 4.8%. Last week that was 5.3, and back in September 9 it was 6.5. The 7-day is 4.9% as of today, 5.0% a week ago, and 5.6 on September 9th. So Sioux County's had steadily declining numbers, and Iowa has somewhat steadily increasing numbers. Going back to Sioux County, kind of been keeping track of the effect of school, colleges being open as well. Not a great deal effect of either of those two phenomena is apparent at this point. 0 to 17 age group in Sioux County is 15% of the positivities. 18 to 29% group is 23. So between the 0 and 29 group, we're at 38%. A week ago, we were at 40%. Really not a lot of change there. The larger percentages are still in the over 50 group. And so that really hasn't changed. We're certainly not seeing the hospitalizations occur or the acuity level in general occur in conjunction with these positive rates. So that's kind of where we are from a local standpoint. What I'm going to try to do is share a screen here. And we'll talk through a few of these numbers. These are this is readily available each Monday, Wednesday, and Friday on the coronavirus.iowa.gov website. And so you can certainly stop and take a look at those. And again, they're updated 3 times a week. What I've done is I have the last 3 weeks of information, and so I'll walk through some of that with you right now. As you can see, the state rate here is 9.5% the past 14 days. Again, that has some value, but is not like the one statistic that you need to hang on. The more important number is the number of patients in the hospitals. And you can see here that 641 patients were in hospitals, COVID-19 patients were in hospitals in Iowa as of today. That number a week ago was 579, and a week ago, or prior to that, was 549. So in a 2-week period of time, we've gone from 549 to 641. So those number of positives are manifesting themselves in the form of hospitalizations, and we'll continue to talk through that. Hospitalizations are one thing, being in the ICU is another. And so when we look at COVID patients in the ICU, as of today, it's 151. A week ago, it was 158. And 2 weeks ago, it was 153. So maybe a little bit of decrease in the acuity level statewide, but nonetheless, still a lot of people in the ICU, a lot of people that are really sick. The number 80 here represents the number of patients admitted in the last 24 hours. Kind of gives you an idea of what is in store. That's a pretty high number. A week ago, that number, as an example, was 72, and a week before that at 64. So 80 is a fairly high number, so we probably will expect the hospitalization number to go up as well. In terms of the vaccination status within the state of Iowa, and we have to believe that these numbers are relatively accurate. Right now, as of today, the state of Iowa would say that we have 65.8% of Iowans fully vaccinated. A week ago, that number was 65.2, and 2 weeks ago, that number was 64.6. So we're climbing very slowly, but nevertheless climbing. And so 64.6 and today's 65.8. That means we've vaccinated 1.2% of the population in the last 2 weeks. Looking at the death total, we are at 6,482. That, in terms of the analyzing those deaths and the demographics involved, not a lot has changed. A very important part remains that 0 deaths have occurred in the age group of 0 to 29. So no one under the age of 30 has died in the state of Iowa from COVID. That's very important when you mesh that data with the number of positives within the 0 to 17 group and also the 18 to 29 group. Also, to further exacerbate that statistic is that 92% of these deaths are in the 60 plus group. So this continues to be higher levels of acuity in the higher age brackets, and certainly remains those with pre-existing conditions. The last time I looked at that, I believe there are 92% of the deaths were associated with a pre-existing condition as well. Coming back to a couple of the other numbers that we have on this page, we have 85.3% of the COVID-19 patients in the ICU represent non-fully vaccinated people. So 85 out of every 100 people in the ICU are unvaccinated. Similarly, patients hospitalized, 78% of those hospitalized account for unvaccinated folks. So 22% as of today of people in the hospital were vaccinated, 78% not. Those numbers have fluctuated a little bit up and down. And it's not that relevant from a comparability standpoint. What is relevant is that while the vaccine does not make you bulletproof, it without question lessens the acuity, lessens the likelihood that you will be seriously ill. There's no question about that. This is backed up by the state of Iowa information here. It's also backed up by the data we've looked at Sanford, and it coincides with statistics from all over the country that we're seeing. So it does not prevent transmission fully. It does not prevent infections fully, but it does, without question, reduce the likelihood that you will be infected, and then if you are, the severity of the illness. The last statistic on this question, or on this page, is the long-term care data, and that there are currently 26 long-term care facilities in what they call outbreak status. That is at least three, so 3 or more residents in a nursing home test positive, then it's officially an outbreak status, and you need to take additional steps of precaution. That number has been growing steadily. Early August, that number was 3. And so the highest number that I saw was from last Wednesday, I believe, and that was 30. So it actually has gone down to 26, but it's still, think about it, 26 nursing homes in the state of Iowa have outbreak status currently. So still real. Again, I don't have the information of how many of those folks were vaccinated or not vaccinated. The majority probably would be vaccinated, I would guess, but I can't say that definitively. All right, so that's it for the sharing of those stats. Again, they're available, Iowa, coronavirus.iowa.gov, and you can look at those as updated every 3 days, Monday, Wednesday, and Friday. I want to talk about a couple other things. The healthcare vaccine mandate, certainly a huge topic for us as we look to our future. September 9th, President Biden made an announcement anticipating the mandate for healthcare workers. That's about 20 days ago now, about 3 weeks. So far, we've had nothing in terms of any detail. There have not been any deadlines or implementation dates, requirements for or loopholes, all those kinds of things. We have had nothing since September 9. So at this point, there is no mandate at Orange City Area Health System for employees to be vaccinated. We do not anticipate issuing a mandate unless it is required by the federal government. And like I said, to date, we have no information to share relative to that. We remain pro-vaccine, anti-mandate. There are more benefits right now for that position, we believe collectively, in our ability to care for people than by issuing a mandate. As I've mentioned, the vaccine is very clearly doing its job. It's readily available. We encourage that, but we also respect people's right to choose. So that's where we are, and that's what we know about right now. We are not anticipating a mandate here at Orange City Area Health System in the near future. Boosters are another topic that is of interest and extremely confusing. It's confusing to us, let alone folks outside of healthcare. First of all, the booster is only available for Pfizer, folks who have received the Pfizer vaccine. If you've received Moderna, you're totally off the grid here right now. But if you have Pfizer, not much more on the grid, to be honest. The booster has been approved for immunocompromised patients only, as defined by or as ordered by a physician. So it is also available to frontline workers, healthcare workers. It is also available to long-term care residents. And so that's where we are. Lots of questions on the booster. It is not widely available right now. If you receive the Moderna vaccine, which we, most of us in this community would have, because that's what we offered here, there is no news right now at all. So please don't call regarding what's going on with the Moderna booster, because it's nothing. If you do have questions on the Pfizer booster, if you receive that at maybe a Hy-Vee store or someplace else, give us a call, 737-2000. We'll get you to our triage nurses, and they will answer questions that you might have on the Pfizer booster, but nothing with J&J, nothing with Moderna. Another subject that's out there is vaccinating children ages 5 to 12. The short answer to that is nothing has changed. We are anticipating guidance later October regarding immunizing children 5 to 12 with the COVID vaccine. So you hear lots of stories out there, lots of reports that it's going to the FDA, all that. Nothing's happening regarding children's vaccinations. So stay tuned as we learn more. Certainly we'll do that, but again, we're not anticipating any new information for at least a month. Another topic, things going on at Orange City Area Health System relative particularly to COVID and masking and cafeteria being closed to the public. All of that is going to continue. We're not making any changes in this. We believe we might be hitting kind of a plateau in the COVID, but we need to make sure we need to ride this out a little bit. Some of the indications that we're having around us, particularly through Sanford and the information that we have, indicates that we perhaps are plateauing, but we're not sure. We're just going to stay vigilant, keep all of our masking policies as they are, keep the cafeteria closed for the time being, and no change in that. The major issue that we're really working through, and this is across the country now, excuse me, is hope I can get through this with my voice. It's our workforce issue. That is the major issue. That's just not just in healthcare, but everywhere. This is affecting the healthcare industry more so than COVID, quite frankly, particularly in this part of the country. Workforce is way more of an issue than COVID. I know, as an example, Sanford had something like 23 COVID patients in the hospital last week in Sioux Falls, last week Friday. They have 400 other people in the hospital. So the census is being, workforce is being affected by a census that is surging, but surging for more reasons than COVID. There's a stat that I saw is about 70 to 80% of the nursing homes nationwide are short-staffed. And so it's literally all over. We're trying to do what we can to make sure that Orange City Area Health System is a great place to work for our employees. We're trying to make sure the culture is appropriate, make sure they have all the tools that they need, make sure they're being compensated in a fair way. But it is a major issue, as we all know, in various industries and segments from around the country. Just one more thought or topic that I have, and that is our walk-in clinic. We did a survey the other day, and we have 121 zip codes that have been served in our walk-in clinic in the last 8 months. 121. The walk-in clinic has been experiencing volumes that we did not anticipate, quite frankly, and we're trying to do the best that we can with that. We ask for your patience with that. The issue is much more complex than simply expanding our current clinic. We can do that, but there are rules and regulations and a number of things that I don't want to get into right now. But we are well aware that the volume in the walk-in clinic is way beyond what it was designed to be. We're trying to do the best we can, and we ask for your understanding as we go through this. Finally, today, I just want to remind everybody to keep your engine tuned. We're going to talk about that later in October. We're going to have Dee Meredith and Olivia Chapman talk to us specifically about what we mean by keeping your blood sugars in line and how that works. But that's all part of keeping your engine tuned, but not the only part. Blood pressures, fitness, all those kinds of things. Weight loss certainly is a big one. So just a reminder to do that, to get outside, enjoy things, and just in general, stay active. I think that'll do a lot for our mental state at this time too. So just in closing, I read this thing the other day about the risk, and it goes something like this: is the risk is low enough to live life, but high enough to be careful. And when we think about that, you think about threading the needle, right? And live life, enjoy life, get out there and enjoy things, especially outside. But keep in mind all the stats that we provided today. And we again thank you for listening to the video today. We'll have more in the future. And for those of you who are our patients, thank you. We appreciate that, and we continue to pledge to be here to take care of you. Thanks again for joining us.